At this year's GU ASCO Symposium, we have a few key potentially practice-changing presentations, and then there are many other key presentations, and of course, lots of translational research, data, and emerging data with new drugs. I think that I wanted to highlight just the most major presentations here. I think I would highlight three presentations, which are all oral presentations, which are, in my opinion, the most major presentations. The first one is the trial by the US cooperative group called the Ambassador trial, which looked at pembrolizumab as adjuvant therapy for high-risk muscle-invasive urothelial carcinoma. And this study has been in the news a few months ago as a press release showing that adjuvant pembrolizumab improved disease-free survival in this high-risk muscle-invasive urothelial carcinoma patients. And so it met one of the co-primary endpoints. The other co-primary endpoint was survival. So we're looking forward to the presentation of this data in the oral presentation. We haven't seen the specific data yet publicly. And the second of the three major presentations that I wanted to talk about was the study called the CONTACT-02 trial, which looked at patients with metastatic castration-resistant prostate cancer, in which patients who had progressed after a novel hormonal therapy agent received cabozantinib plus atezolizumab. And in this trial, this combination was compared with a second novel hormonal therapy agent these patients were getting in the control arm. And this study was also reported in the news as a press release a few months ago, showing that it met the one of the primary endpoints with progression-free survival improvement with the combination of cabozantinib and atezolizumab. So I'm looking forward to this data set. And then the third data set I wanted to highlight was the Keynote 564 trial, which looked at adjuvant pembrolizumab in high-risk localized clear cell renal cell carcinoma. And this study, of course, has already been reported before for disease-free survival, which was met. And based on the disease-free survival, pembrolizumab has been approved in patients with high-risk localized clear cell RCC. And we were all looking forward to the key secondary endpoint of overall survival. And now this also has been met. And so we'll look forward to the data. The survival news was in the press release again recently. So look forward to looking at the specific data here. These are the three key presentations, in my opinion, which are potentially practice changing or practice impacting. But there are some other presentations I did want to highlight, which I would say are also key presentations. So one of them is the update of the EV302 trial. This was the metastatic urothelial carcinoma first-line trial, which was reported at ESMO 2023 and showed an improvement in both overall survival and progression-free survival, and led to US FDA approval in December 2023. And so now we have an update of this and looking at various subsets of patients in this trial to see, to tease out more of the benefit and the benefit in various subsets. So look forward to that. And then there is an update on the patient-reported outcomes in the phase 3 trial in advanced renal cell carcinoma, in which belzutifan, the HIF2 alpha inhibitor, was compared with everolimus in the post-VEGF and PD-1/L1 inhibitor setting. And this trial, of course, was reported as positive with improvement in progression-free survival at ESMO 2023. And so now we look forward to looking at the patient quality of life data and patient-reported outcomes from this trial. And then there was one trial I wanted to highlight, which looked at metastatic RCC and compared subcutaneous nivolumab versus intravenous nivolumab in advanced RCC following prior therapy. And so this was a study primarily looking at pharmacokinetics and the differences between sub-Q and intravenous nivolumab. And this was reported a few months ago in a press release and also at ESMO. And we await further data from this trial at the GU ASCO Symposium. And potentially this will allow nivolumab to be given subcutaneously, which could be more convenient for some patients and could have some advantages. And then there was a trial called the Embark trial, which has been reported many months ago now, which showed and brought enzalutamide into the space for high risk biochemically recurrent castration sensitive prostate cancer. And this led to regulatory approval in the US for enzalutamide for high risk biochemically recurrent prostate cancer. And that was in patients that received enzalutamide alone or enzalutamide plus androgen deprivation therapy. And so in this trial, there is an update here at the GU ASCO Symposium, where they are going to present some data in patients who had suspended enzalutamide therapy, monotherapy, in this three-arm phase 3 trial to look at outcomes in those patients. So I think that would be of interest, and an update of this Embark trial, which has, of course, already had a practice-changing impact for patients with high risk biochemically recurrent prostate cancer that are castration sensitive. So I think these are my key highlights with respect to practice-changing and potentially practice impacting trials, as well as new data that may have an impact based on the subgroups and the route of administration in one of the trials I mentioned. So those are my major highlights.